A very good day, everyone, and welcome to today's webinar on digital eye strain. My name is Kavya, and I'll be your moderator for this session. It's great to see you all joining us to get into the important topic of digital eye strain. We are honored to have with us Dr. Amod Nayak, Regional Head of Clinical Services at Dr. Agarwals Eye Hospital in Bangalore. Dr. Amod is a renowned expert in ophthalmology with extensive experience in managing the effects of decreased vision, distorted vision, excess tearing, injury to the eye, pain in the eye, unusual red eyes, and blurring of eyes. He believes that simple symptoms must be consulted immediately to prevent any complicated problems and follows an evidence based ethical approach to his evaluation and treatment methods. Today, he'll be sharing his experience and practical tips on how to protect our vision in this digital era. We'll begin with Dr. Amod's presentation, followed by live question and answer session where you'll have the opportunity to ask questions. If you have any questions during the presentation, please feel free to type them into the chat box and we'll address them during the question and answer session. Now, before we start, please make sure your microphones are on mute to avoid background noise. Further, this session is being recorded and will be available for you to revisit the information chat. Without any further ado, let's welcome Dr. Amod Nayak to enlighten us on the digital eye strain. So, yes, Doctor, the virtual floor is yours now.
Thank you, Kavya. So, good afternoon, all. I am Dr. Amod Nayak. I'm an ophthalmologist by profession, and I work for Dr. Agarwals Eye Hospital, Whitefield, Bangalore. Today, we will discuss a topic relevant to all of us on ophthalmic wellness. I have decided to speak on digital eye strain because of the relevance. My professional experience also reiterates this fact because one-third of patients who seek medical help with me or in my hospital from urban Bangalore are having similar kind of problems. I have tried to make the presentation more pictorial and visual rather than lengthy slides for easier interpretation and registration. Any doubt or query, please keep sending across to Kavya and who is moderating the session, and I will take it later as she told. So computers are bigger. This is the agenda of the meeting. These are the topics I will try to cover in as concise and as easy I can make it to make you understand. So computers have become an integral part of our human life, be it leisure, communication, work, or entertainment. Computers are everywhere. Digital revolution is so strong that even government is promoting it. With life shifting indoors during the pandemic time, screen usage have increased further. Our dependence on screen have increased further. It's a double-edged sword. With the benefits of technology, there is a negative impact as well, and our eyes bear the most brunt of it. Look at the following symptoms: eye pain or eye fatigue, double vision, back pain and shoulder pain, dryness in the eye, blurred vision, watering or redness. Have you faced any of these symptoms? If your answer is yes, you, my friend, are having computer vision syndrome. Before I go into details of who, how, and why of digital eye strain or computer vision syndrome, let me give you a little about the anatomy or physiology or the structure of and working of the eye. To make it simpler, we can the best analogy I can give you is comparing eye to a camera. So, like camera, the cornea of the eye functions as the lens. The iris and pupillary aperture controls the amount of light entering the eye. The lens and the ciliary body apparatus becomes the helps in focusing, and the retina is like a film of the computer of a camera. Tear film is an integral part of eye, helping in both the nourishment of the cornea as well as maintaining the ocular surface clarity. Now, tear film, contrary to popular belief, is not just water. It's a complex structure of carbohydrates, proteins, and lipids. It is secreted from multiple sources on ocular surface, including the lacrimal gland, the accessory lacrimal glands, the meibomian glands, and the goblet cells. The inner layer being the mucin layer, the intermediate layer being the aqueous layer, the outer layer is the lipid layer, which helps in reducing the evaporation of the tear film. What are the effects of excessive usage of screen? The common symptoms are headache, neck and shoulder pain, eye pain and strain, irritability in behavior or irritation in eye, both ways, reduced attention span, reduces emotional and social development, especially in younger age group, the pediatric and the adolescent age group, obesity, disturbed sleep, computer vision syndrome, and myopia. The later two being specific for ophthalmology. What is computer vision syndrome? Computer vision syndrome is a variety of vision-related symptoms caused or aggravated by regular and prolonged usage of digital devices like computers, mobiles, tablets, or laptops. What are the symptoms of computer vision syndrome? I have told this further before, but I'm going to stress it once again. Double vision, temporary nearsightedness, meaning your far vision is blurred, dry eyes, photophobia, which means decreased tolerance to light or pain on seeing bright light, headaches, eye strain, redness and watering of eye, neck ache and backaches. So why computers and digital devices are culprits? Or rather, if I frame a question, why is a paper better, pen and paper better, or a book is better than a computer? So as I told you, it is occurs because of prolonged digital usage of screen. Digital screen can cause working on a digital screen. You have to work. A person has to work harder than normal. There are several factors responsible for it. First is compared to a paper printout, the screen content is less sharp or less focused. Poor contrast of screen against the background, reflection or glare which emits from the screen or bounces from the screen rather, and the blue light getting emitted from the screen. These factors also contribute to computer vision syndrome. Viewing the screen in a low light, being too close or too far from the screen, position of a screen at an angle which causes eye strain, and taking insufficient break. Together, all of these factors put together causes a greater demand on the eyes, and demands are even higher when there is uncorrected vision problems. If given over an extended period, a person may have experienced or may have experienced the symptoms of computer vision syndrome. So as I told you, the causes are poor ergonomic, basically the how you are sitting or working in your workplace. Because I'm talking about the office situation, be it at your work from home scenario or you doing working at your office, how the screen is and how your sitting arrangements, how the light, how the humidity of the room, how the airflow is there. That is one, the working environment. Second is the glare and reflection from the light. I told you, screens, because they have they reflect the light getting emitted or bounces, or the light bounces off the screen, which causes glare. So especially the light coming from your office illumination or the room illumination. Refractive error. So now, what is there are basically four types of refractive error. A normal individual who does not require glasses will have rays coming from far getting focused on the retina, the left picture on the left side of the screen. If the rays gets focused in front of the retina, it is called short-sightedness or myopia, and which can be corrected by a concave lens. If the rays is getting focused behind, it is called hyperopia, and it can be corrected by a plus lens or convex lens. The other two refractive error are astigmatism, where the rays are not getting focused in one plane rather than either plane in one meridian. So if, for example, the perpendicular rays are getting focused on the retina while the horizontal rays coming are getting focused behind. The fourth disease is called presbyopia. Comes with aging, usually seen after 40 years of age, and it is because of weakness of ciliary muscles. Blinking is very important for human eye. A normal individual blinks around 22 times per minute. While working on computers, we tend to blink a lot lesser because we are concentrating, and it goes to as low as 4 to 6 times per minute. Now, why blink is very important is every time we blink, the tear film gets replenished. Now, non-blinking causes this tear film to break down, and it goes to a vicious cycle leading to release of inflammatory molecules and causing digital eye strain or computer vision syndrome. So how to take care of eyes? I have told all the problem statement. What we can do to reduce or having such problems or avoid having such problem, or if in case problem happens, we how to take care of them. So for first and foremost is comprehensive eye examination, which entails checkup of your visual acuity and refraction, anterior segment examination, and a detailed retinal examination. Relevant investigation will be advised by an ophthalmologist as and when required. If there is a refractive error, ideal is to get a correct powered glasses, which is according to a refractive error, from a advised by an optometrist or best in case an ophthalmologist. So I've talked about the blue light. I will discuss with little further. Blue light is also known as high energy visible light. It is the shortest wavelength light, therefore the highest amount of energy is there. Prolonged usage or exposure of to the blue light causes concern, is harmful to the eye as well as the body. It causes damage to retinal cells, particularly in children and teens. Long-term problems can occur, something known as age-related macular degeneration on your left side, as shown, or cataracts. It can also decrease the natural release of melatonin and disrupt the sleep cycle. So what is advisable is a blue protect lens, which will reduce or eliminate the blue light entering inside the eye. I had talked about glare of emitted from the screen or bouncing from the screen, and it is postulated to be a problem or a cause of digital eye strain. So anti-glare glasses do help in reducing the amount of glare entering the eye. Scratches are on the lens will cause diffraction of the light entering and will cause visual disturbance. So ideally advisable is to use a scratch resistant lens. Sunlight, going outside in sunlight, especially in our tropical climate, there is UV light in the sunlight. So it is best to protect the eyes with the help of polarized and UV protective sunglasses. Coming to the posture of screen. Most of us who work on screens or in office are on 8 to 10 hours in our office, and posture and on a sitting posture. An ideal posture does help in reducing digital eye strain or computer vision syndrome or having body pains or aches. So look at the spine structure. If you look, there is a anterior curvature of spine at the lumbar area and a back curvature of spine at the thoracic and cervical area. Now, if we try to maintain this posture where this is the easiest posture to maintain because you don't need to exert or strain any muscle to maintain this posture. If you try to keep your neck too erect and up straight, you will have to pull some muscles on the back of neck and it will cause strain. So easiest posture while working you should be sitting nice and relaxed. Your screen should be 2 feet away or an arm's length from your body. The computer or the screen should be below at your chest level. So your working should be looking nice and down. Your arm should be resting or your hand rest. The leg should be resting on the floor, and back should be supported by the backrest of the chair. Blinking. I told you blinking is very important because it redistributes the tear film, which avoid dryness and irritation. So what I suggest is blink every time you you press the enter key or the right click of the mouse. Working environment. Now the screen brightness. The brightness of your display should not be left as a default setting. But should be adjusted according to the brightness of the room where you are working. Ideal office brightness, normal office brightness, 300 to 500 lux. So the ideal screen brightness should be 100 to 150 candela per minute. But When I give you such numbers, even I somehow will not able to understand, will not able to measure it. So what is the most practical way of doing it is take a A4 sheet, keep it next to your screen, increase or adjust the brightness of the monitor so that the white A4 sheet matches to your screen brightness, and that's the ideal screen brightness. Your room lighting the room should not be too dark, brightly lit or too darkly lit. It should be ambient light, and it should be indirect and diffuse lighting. Direct light will cause glare bouncing from the screen, so indirect illumination and diffuse illumination is better. We can have a non-glare panel on your screen, especially people who work a lot and on animations, to reduce the reflection from the fluorescent light. Our sitting should not be positioned where wind is directly or airflow is directly on your face, because airflow, direct draft of air coming on your face will cause evaporation of tear film. It's ideal to have deflector or install an air vents to have a airflow directed away from your face. Humidity should be maintained at around 40 to 60%. Low humidity can cause dryness and due to tear evaporation. Important is to take a break. The 20-20-20 rule is very important. It's an era of 2020. So every 20 minutes, while working on computer, every 20 minutes, take a break of 20 seconds and look 20 feet far is what is advised globally. The exercise, what you can do is try to do a figure of 8. It helps you to redistribute the tear film. You take the eye to your left, then go up and then make a figure of 8 with both your eyeballs. If, in spite of all this, if you someday you have symptoms in the eye, which is of redness, stinging or burning, blurred vision, photophobia or sensitivity to light, excessive watering or tearing, foreign body sensation, itchiness or drooping of eyelid, best is to consult an ophthalmologist. They will prescribe you lubricating eye drops, which can be carbomethyl cellulose, HPMC, polyethylene glycol, or sodium hyalurate, depending on your condition, in forms of topical medication, eye drops, or eye ointment. These can be used for longer duration without any side effects. The preservative-free ones are better eye drops. If there is associated inflammation, doctor may prescribe you anti-inflammatory, steroidal or non-steroidal medication. I always recommend to consult an ophthalmologist before taking any medication and avoid doing OTC medication or self-medication. Besides, what helps is a balanced diet. What is good for an eye are antioxidants, the common antioxidant being vitamin A, vitamin C, vitamin E, carotenoids, lutein, and zeaxanthin. Now, the source for vitamin A, carotene, lutein, and zeaxanthin is green leafy vegetables. Colored fruits and vegetables like pumpkin, papaya, beetroot, carrot, oranges, tomatoes. For vitamin C, it is the citrus fruit, sweet lime, oranges, grapes, and guava. And vitamin E comes from nuts, almond, walnut, cashew, groundnut, and non-veg like fish. Food rich in fatty acids like omega-3 or omega-6 fatty acids are also help avoiding dry eye. Keeping oneself hydrated is very important. Daily intake of 3 to 5 liters of water is advisable unless there is any contraindication. Coming to the last part, if someone wishes, we can say no to the glasses by doing a surgical intervention. It's a choice to make you glass free and increase your confidence and overall efficiency. There are surgeries available called LASIK, SMILE, or femto-LASIK, which can help you get rid of your glass power. So my take-home message to all of you is your eyes are precious. Please take good care of them. Thank you. And any questions, you please direct to Kavya. She'll ask me the questions on your behalf, and I will be more than happy to solve all your queries. Thank you. Over to you,
Yes,
Kavya.
thank you, Doctor, for that insightful presentation. Now it's time for a Q&A session. I see we already have some questions from our audience. Let's begin with the first one. Uh, I'm using specs from past 2 years. I don't like wearing specs, so I'm planning LASIK surgery for my vision. It's minus 1.75. I'm 25 years old. Is it safe to go for LASIK surgery? This is the
Yes.
question, doctor.
So 1.75 is a decent enough power. We can easily get LASIK done at that power. And LASIK surgery or the different types of refractive surgical procedures, be it LASIK, femto-LASIK or SMILE, they are one of the most safest surgery globally. The predictability of result and the repeatability of the results are much better. So LASIK is pretty safe surgery. You can go ahead and get LASIK done. Karthik.
Yeah. So, are there any vitamins or supplements that may reduce the risk of digital eye strain?
So I told you diet-wise, you can have food rich in vitamin A, which is green leafy vegetables, colored things like pumpkin, papaya, beetroot, carrot, orange, tomatoes. They will have other antioxidants like carotenoids and lutein and zeaxanthin. And then vitamin C comes from citrus fruit, and nuts give you vitamin E. Omega-3 fatty acids, the omega-3 and omega-6 fatty acids are also advisable. These are natural sources. And then if you consult, it is available in a tablet form also, where you can oral supplements are available by different pharmaceutical companies, and you can meet your ophthalmologist and they will prescribe you if required.
Okay. So, the next question is how frequently should I schedule my eye checkup and address any issues related to digital eye strain?
So normally for a normal individual working adult who does not have any complaint as such, annual examination is advisable. But if you have any symptoms, you are should consult the ophthalmologist before any medication. Annual eye checkup is what I advise for adults 18 to 40 or 45 or even 50. Younger generation, like pre-adolescent kids, or elderly beyond 55, I advise to get a 6 monthly examination. If there are comorbidities like diabetes or hypertension, or some ophthalmic problem like glaucoma or something, it is a little more frequent, 3 monthly or 6 monthly. So it's best to consult an ophthalmologist. For a normal adult, annual eye examination is more than enough.
Okay. So, the next question is are there any preventive measures I can take to minimize the risk of developing dry eyes?
So I told you that commonly I get your eye checkup done. First thing, simple. Second thing is if there is any glass power, get the appropriate glasses advised by your ophthalmologist or optician or optometrist. The second. Third thing, if they prescribe medication, uh, do use the medication if there are any symptoms. Fourth thing will be avoid unnecessary usage of screen. So whatever can be done on pen and paper, avoid a screen, because we have got so much addicted to screen that if you are free, 10 people are sitting at airport, everybody is looking at the screen. So that should be avoided. Uh, it's better to talk to people when you're free, or you can go out and in the and have avoid screen in general. And if you are using screen because of your work entails that you need to use a screen, follow the 2020 rule, the blinking of the eye, the movement, figure of eight exercise, then the posture, and whatever I told you about the ergonomic of the screen, where you can how to keep the what is the ideal brightness of the monitor, what is the ambient humidity, and what is the ambient how the airflow should be. And all this, if done, will reduce our chances of having a dry eye. I do use screen because we work on an EMR and it's a digital platform where we work. My screen usage is there, but I usually take breaks. I don't keep my phones with me during my work time. So unnecessary screen is avoided. I try to minimize it as much as possible. Kids and all, I tell absolutely zero screen unless it is advisable for academic purpose. Kavya, you're muted. Kavya, you're muted.
Yeah, sorry. Yeah, doctor, the next question is I get sudden intense burning and watering in my eyes while using laptop or phone at very low brightness. Could it be due to a lower frequency of blinking?
So you are having some amount of dry eye. Brightness should not be very low, and you should not use screens, especially when with lights off in the night. So the burning, watering in is because of dryness. So you consult an ophthalmologist. Avoids usage of screen with low brightness. It should be the room should be ambiently lit, and your screen should be matching that brightness. Contrast using a highly bright screen in a dark night room is not advisable. You may require some medication initially to reduce a symptom to give you symptomatic relief.
Can I move on to the next question, doctor?
Yeah, please.
What is your recommendation in terms of exercising eyes every day before getting on to regular work, office work using computers?
So before you can do, if you don't have, what I recommend is that figure of eight exercise you can do before doing blink frequently. And I will rather than before, you should blink during. The 20-20-20 rule is something which is a global recommendation. So there are apps available now which tell to blink. So what I simply say is blink every time you use the right click or enter key. So it's a reminder for a blink. We should voluntarily blink. Blinking will reduce the problem of dry eye to a significant amount.
Okay, the next question is do you advise us to use blue light eyeglasses while working with laptops?
Yes, it was a blue light protect glasses. So any glass which will enter which will avoid blue light or reduce the blue light or eliminate the blue light entering the eye is advisable. Lot of companies have come with their own versions. They have their own trade names. But just before even go visiting an opticians, they have their even instruments or technology to measure how much this particular lens is stopping the light entering. So they can actually measure it also. They have devices to do that. So blue protect lenses, anti-glare lenses are advisable if one is working on a screen, computer or mobiles or laptops.
The next question is does smoking or exposure to smoke impact dry eyes?
Yeah, smoking is anyways not good for body, but smoking with its toxin will cause impact on dry eye. Polluted, let's say, leave the smoke coming from a cigarette or something. Let's say if pollution is there, if you are in an industrial area, the smoke getting emitted from the industry or the vehicles will have toxic effect on the glands in the eye which secrete tear. So they reduce the tear secretion, or they themselves have irritants or chemicals are irritants to eye. So its eye should be protected from any kind of smoke, be it from emitted from the cigarette, or it's a pollutant from the industry or an automobile. So protection of eye from the smoke is advisable. Also, how much you can do it.
Okay. Large screens are very common in every house these days, even though house is small. What is your advice in terms of keeping distance from the screen?
So television, if I will prefer somebody using a bigger screen for, I tell my elderly patients to avoid watching movies or serials on a mobile, rather use a bigger screen. It should be 8 to 10 feet. The screen should be. Only problem with the larger screen will be if it's very near, you have neck pain because to see the screen in one time. So 10 feet is, or 10 to 12 feet is what is ideal. But the challenge being in a bigger city, you will not have room bigger than 12 feet. So 10 to 12 feet is advisable. And in my opinion, it's better to have a bigger screen for viewing something. For example, if your child is doing online classes, instead of giving him an iPad, I will prefer him let them attend on a television where you can project the class or the whatever academic thing is going on. So larger screen is better. May not be very large, but so a normal television at 10 feet is okay. I don't think that's a problem as such. But that also in a duration should not be a long duration with breaks in between.
Okay. So the next question is, what are the long-term consequences of untreated digital eye strain?
Long-term consequences will be you will have some amount of headache, irritation. Your sleep cycle will be disturbed. If you have irritation and start rubbing, then it can induce certain diseases like keratoconus in the eye. If the kid is getting long-term exposure, the chances of myopia increases. Long-term blue light can cause exposure can cause ARMD, and it's been proven to cause cataract also. So that's what. So you can have diseases if not treated and not taken care of. You will have emotional or behavioral changes. In eyes, you can have keratoconus, you can get ARMD, you can get cataract if you're exposed to blue light long. Children can have myopia if or adults. Sometimes I see in my OPD have pseudo myopia where for a temporary because for a temporary time their minus number increases, but the temporary thing is called pseudo myopia. So these are what can happen if there's a lot of digital eye strain or computer vision syndrome.
Okay. Doctor, do you recommend any artificial tears for managing dry eyes?
So it was in part of my presentation. We can use there are a lot of formulations available. There is CMC, carbomethyl cellulose, then HPMC. There's something known as hypermellose, polyethylene glycol, and sodium hyaluronate. I will recommend rather than going to a chemist and let him prescribe, you go and consult with an ophthalmologist, and you can take tear substitute or tear additives. Now there are companies have come because these any medication will have preservative, and long-term uses of preservative medication with preservative can induce dry or inflammation. So now the companies have come with their own preservative-free medication, which if used for long terms won't cause any side effects. So I have patients who've been using for years, and I don't think they are that much troubled with long-term follow-up also. But I would not rather differ from giving a name here just because it's depend on patient to patient what is advisable for each person. But I would suggest you consult an ophthalmologist, get it prescribed to yourself, and then use it.
Okay. The next question is, are there any particular risk factors or habits that might contribute to digital eye strain in my case?
Risk factors is basically the digital eye strain is basically usage of a lot of screens. So if you're using a lot of screen, you are predisposed to it. If you have uncorrected refractive error, then there is a chance of this digital eye strain. Your work environment, as I told you, can cause digital eye strain. So these are diseases. As such, systemic diseases are not known to induce digital eye strain, may cause some difficulty or decrease in tear flow. So there's some lipid disorders, but not. But digital eye strain more of a work-related environmental disorder. It's not that hereditary or some systemic disease involvement. It's mostly work-related.
There's one more question, doctor. Splashing water on eyes in the morning is
Absolute no. It's an absolute no. And I told in my presentation that contrary to a popular belief, tear is water is not. So what happens when you do that is whatever tear is there, when you put a splash of water, it flushes out the tear which is there. The ocular surface becomes raw. So should not be done unless there's a foreign body which has gone and you have an injury. Then only ophthalmologists suggest to wash the eyes with clean drinking water. A regular habit of washing the eye with water is not advisable. We wash our face daily in the morning, but when we do that, it's a reflex habit that our lids will close. You can wash your face, wash the outer side of the eye, but no putting the water of your tap water, even a drinking water inside the eye, unless there is a foreign body injury.
Yes, the next question is, which screen is better, LED, LCD, or plasma?
This is a question I will, and I don't have that much technological knowledge, so tough for me to answer. Uh, but whichever reduces the emits the least amount of blue light, because my technical knowledge of LED, LCD, and plasma is tough. So if maybe you need a technologist, what you can ask your vendor or a person who is working in a computer shop or something, which has a minimal emission of blue light, that's advisable. Now, which LED does or LCD does or plasma does, I don't have a authority to know. I tell you that. But whichever emits the least amount of blue light is advisable, which the screen will have the minimum amount of glare. That is advisable. Now, whether it's LED, LCD, or plasma, tough for me to answer that.
Okay. Are there any specific contact lenses for dry eyes?
No, dry eye does not does not require contact lenses for treatment. In fact, long duration usage of contact lenses itself induces dry eye. So people who have been using contact lenses for really long duration, sometimes they come with trouble of dry eye because of the lens. So lenses are not advisable to avoid dry eye. It's the reverse, long term. So if somebody has a higher power, I will advise him and either go for glasses or can go for surgical correction rather than continuously using a contact lenses with higher. So contact lenses by themselves are cause long-term usage can cause dry 9 years, 10 years. Wrong fitting of contact lens, wrong powered contact lenses can cause eye strain and can cause to dry eye. So it's the reverse rather.
So, yes, if you have any questions or any doubts, you can just make a note on the email ID. It is in the chat box, and there's a number also. Doctor, there's one more question.
Please.
Hi, I'm suffering in keratoconus issue in my left eyes. Is it possible to change the cornea?
So, keratoconus, basically, there are two things. One treatment is it's a progressive disorder. So, you need to stop the progression of keratoconus. It is done by a surgical procedure known as collagen cross linkage. The second part being correction of error, refractive error, is it can be done with glasses when there's early keratoconus. It can be done with specialized contact lenses. There are surgical procedure which can be combined with your C3R, something known as uh, KS or PRK or Smile Extra, or it can be done later by something known as ICL or toric ICL implantation. Uh, Keratoplasty is the last resort to correct keratoconus where cornea has become so weak that we need to replace it. So, keratoplasty, DALK or penetrating keratoplasty can be done, but it is usually reserved for advanced keratoconus. Early or moderate keratoconus can be treated by other surgical methods. Keratoplasty is usually not required. Very advanced keratoconus where there's scarring and then there's thinning of cornea or this almost impending rupture is where we require keratoplasty. There are two surgical procedures for that. One is known as DALK, deep anterior lamellar keratoplasty, other being a penetrating keratoplasty. But that's the last resort.
A few more questions, doctor.
No issues.
I have eye redness problem and actually happen in my eye and came tear in my eye. How to overcome that?
Uh, if you are using screen, it can be due to your computer vision syndrome, or sometimes it can be due to allergy or infection. So best is I will recommend you to meet an ophthalmologist, let him diagnose you properly, and then appropriately give medication for that. Meanwhile, you can reduce your strain on the eye by following the methods I told you about how to avoid computer vision syndrome in the PowerPoint in the presentation.
Okay. Whenever I travel, I get a sty or chalazion. Any suggestion to prevent it?
Okay, so sty and chalazion comes because there are glands in the eye, the lid margin, which are called meibomian glands. These are oil glands. If you have heard my presentation, we have oil or a lipid as the entermost part of most superficial part of our tear film. Now, these glands opening get blocked with the dirt or smoke emitting from the pollution if you're traveling, or sometimes with your hands, which are not absolutely clean, and you tend to touch your eyes. So, what I advise is wear sunglasses when you're out to protect from smoke and dust. Second thing is do avoid, refrain from touching the eye with your hands, which are not absolutely clean. Sometimes with irritation, whether tend to do is touch or rub the eye. Third thing, what we can do is, or she can, or he or she can do is do hot fermentation, meaning take cotton, boil it in water, when it's lukewarm, squeeze the water or apply with the lid, or take a clean handkerchief, warm with the cloth iron, apply to the eye. So basically, you need to give warmth to the eye to let that secretion flow out. Lipid, it's sty and chalazion are more like a pimple, so it's because of blockage of gland. When you do that hot fermentation, the lipid secretion keeps on happening. And if once you get it, you need to consult ophthalmologist to get it treated by medication or surgery, depending what is the case for you. Avoiding is by wearing sunglasses or glasses to avoid smoke and dust reaching the eye. Refrain from touching the eye, keeping eyes clean and dry, and hot fermentation regularly 4 to 8 times a day, depending from inflammation to happen.
Okay. I think we have answered almost every question. So we are at the end of the session.
Thank you
So
so much.
if you have any queries or questions, please write out to us at patientcare@dragarwals.com. So yes, thank you so much, Doctor, for the
Thank you,
more
Kavya.
insightful and informative webinar. We hope you find this webinar very informative and that you'll join us for future events. Stay safe and take care of your eyes. Thank you. Thank you so much.
Thank you. Good day.
Thank you.